Committee. I'm Dan Foreman, Senator District 6, and I'm presenting Senate Bill 1009. This legislation adds a new section 39-9004 to Chapter 90, Title 39 Idaho Code, which is entitled Health and Safety. This legislation establishes a medical patient's Bill of Rights that supports the statement of public policy expressed in Idaho Code 39-9003, known as the Idaho Health Freedom Act. 1009 also reinforces the legislative intent of Idaho Codes 56-1705 and 56-1702, known as the Crisis Standard of Care Act. 1009 expands on the Idaho Health Freedom Act and Crisis Standards of Care Act by placing prudent, dignity-based, and needed restrictions on state government and healthcare providers through the establishment of a Patient Health Rights Bill of Rights. The health rights listed in this legislation, while not contradicting the authority of the state or healthcare providers to deal with health emergency situations, does refine and define the limits of that authority in certain applications. This legislation recognizes the need for and the authority behind state-directed restrictions placed on individual citizens for the common good. However, Senate Bill 1009 prohibits in general restrictions to quarantine, close businesses, wear facial coverings, or to social distance. This legislation does not prohibit government advice to this effect, but it does not allow in general mandates. This legislation codifies a number of important health care rights, such as a patient cannot be denied treatment for refusing a vaccine. The state cannot advertise for recommended public use any vaccine or drug classified as experimental by competent medical authority or that has not been fully tested and approved according to accepted standards of clinical testing. No patient shall be administered any experimental drug or medication unless the patient or his legally appointed guardian provides signed, informed, written consent. Visitation by a patient's family members may be denied by the attending physician for sound medical reasons, but general denial of visitations shall not be instituted as a matter of administrative policy. This legislation states a patient may not be prohibited by the state from bringing a legal cause of action against a healthcare provider. Now, I'm not aware of any situation to that effect occurring in the state of Idaho, but governors in the state of Illinois and New York issued executive orders to that effect. And the federal government invoked the PrEP Act, P-R-E-P, which stands for Public Readiness and Emergency Preparedness Act. And PrEP provides legal immunity from liability, except for willful misconduct, to healthcare providers against any claim of loss caused by, arising out of, relating to, or resulting from the manufacture, distribution, administration, or use of medical countermeasures, which would be related to the COVID pandemic. This created a terrible conflict of interest environment, considering the huge sums of federal aid being transferred to the healthcare industry. This situation left some who believed they had a valid cause of action for malpractice with no way to seek redress. The Idaho Attorney General may take action under Idaho Code 67-1401 sub 15 in the defense of rights listed in this legislation. Basically, that would be injunctive action. Now, the AG's office has reviewed this bill and decided the bill does not conflict with any provisions in the state or federal constitutions. It is not the intent of this legislation to make accusations or direct blame at any healthcare provider or organization. I have the highest respect for our healthcare industry as a whole. However, it is the purpose of Senate Bill 1009 to codify protection for the people of Idaho in the form of a patient bill of medical rights based on common sense and respect for our fellow man. And with that, Madam Chair, I would be happy to field any questions.
Committee, questions of the committee? Senator Lee.
Thank you, Madam Chair. Thank you, Senator. A lot of what you have is similar to HIPAA, some of those protections that we already have. And so I'm specifically trying to figure out in the first section under the health rights. So I understand your intention on 1A. I think I understand the intention on 1A. But much of the rest of this is, seems self-explanatory, but if I go to 1.4, that seems to be broadening some of the protections in Idaho, and then it says, or any other basis prohibited by federal law. Can you talk about the inclusion of sexual orientation, gender identity, and those areas? Seems to be codifying federal law in our statute.
Senator Foreman.
Madam Chair, Senator Lee, great question. Glad you asked it, and you deserve an answer to that. We're talking about health care here for people and folks not being turned away or denied care. And it is federal law. Some of the things you mentioned, sexual orientation, gender identity. Now a person can take whatever position they want on those issues, for or against, but we're talking about human beings presenting themselves for health care. What type of health care? Who knows? It could be emergency, it could be elective, it doesn't matter. But just like if I was a doctor, I couldn't say to you, I'm not gonna let you in my clinic because you're a woman, or because you're a minority, you're black, or whatever. That's just totally wrong. And the state of Idaho agrees with that. Now, the state of Idaho doesn't have the sexual orientation or gender identity. And to be quite frank, I got criticized for putting that in there. But those people are human beings as well. And again, we're talking about whether or not they should be turned away from a healthcare provider. I say no. I say there should be no reason why any human being gets flatly denied offhand the necessary service of healthcare. So I put it in there, and sure, it drew attention from some people who say, well, you're expanding federal control. Well, if I didn't put it in there, I would be ignoring federal law, and I think it would be taken as an affront to those people who are defined by some of these terms. So I put it in the bill.
Madam Chair,
Follow up.
Thank you, and I appreciate the explanation. And I'm less concerned about the individual words and more concerned about codifying federal law. Would it be more appropriate in your response that you just gave to say no person for no reason at all should ever be turned away? Is that what you're trying to say there?
Senator Foreman.
Madam Chair, Senator Lee, I could have said that. That would have summed it up. I felt it was important to add more specificity and refer to the federal law, because I think the complaint I would have heard if I didn't, number one, I wanted to do it. Number two, if I didn't do it, people would say, well, did you deliberately stay away from certain categories of people because they're hot button issues? And I wanted to make it perfectly clear. This is not a political bill. This is not a Republican, Democrat, left, right, conservative, liberal. It's not. It's a bill that was born out of necessity because of some of the things that happened during the COVID crisis and situation. And again, I'm a big supporter of our healthcare system. I wouldn't be standing here today if it wasn't good on the military side and good on the civilian side. I've had excellent care. I have the highest respect for doctors and particularly nurses, since they're the ones that generally do most of the work to get you back on your feet. But some things didn't go the way they should have gone during COVID. Again, no finger pointing here, no blame being assigned. I'm here to help the people of Idaho with this patient bill of rights. So we sat down, I did with many constituents, and we discussed, how do you want to be treated when you go to a healthcare provider? And I've always received the type of treatment listed here. But I talked to many people who during COVID, for whatever reasons, that's a subject for another time, they weren't treated this way. So I think it's necessary to codify this with some specificity. And, you know, I've looked at, I don't know how many bills today. Couldn't tell you how many. It's been a long and busy day, but a productive day. But I've seen reiterations of federal code in many of our state bills. Now, I'm not a big fan of that, as you know, but sometimes it doesn't hurt to reiterate certain things just for emphasis if they're extremely important. And these things are important to every man, woman, and child that will someday present for medical treatment. We all get there in one way or another. So I thought it was important to put it in. But I hear what you're saying, and I'm with you on that.
Senator Taylor.
Thank you, Madam Chair. Thank you, Senator Foreman. I appreciate all the work you've put into this. I will agree with you. COVID was a whole different time and a different topic, and we should probably not incorporate that into this document going forward. But can you give me one instance of a human being in Idaho being refused medical attention based on their sex, their age, their race, their national origin, their ethnicity, their religion, their sexual orientation, their gender identity, their veteran or military status, or any other basis?
Senator Foreman.
Madam Chair, Senator Taylor, yes. Family member was denied medical care because she wouldn't take the COVID shot, and she had a heart attack, and she died. And that's part of the reason why I'm here.
Senator Wintrow.
Thank you, Madam Chair and Senator Foreman. I really appreciate subsection 4, and I'm really happy that we're in agreement on that. It feels really good. Because subsection 4 says a patient cannot be refused treatment based on, and all those identifiers. I really appreciate your discussion about federal law and following that and making sure human beings are given medical treatment as they deserve, regardless. I really appreciate that. I mean, that stands on its own. You could run that bill and I would vote on that in a second. My question is, so again, just thank you for that. Thank you for that. I guess on a side note, would you also agree as far as this notion of discrimination when it's regarding housing or unemployment? Like, as human beings, is it appropriate for somebody to deny housing or employment based on one of these categories?
Senator Wintrow, I think we need to stick to the bill, please.
Madam Chair, if with your permission, I don't mind quickly responding to that. Thank you, Madam Chair. Senator Wintrow, absolutely. Human beings are human beings. In certain circumstances, which were small and private, I could understand where people would say, well, I have a religious or moral objection or whatever, so not in my house or not with my kids. But, you know, I've traveled the globe, I don't know how many times in previous jobs. And I've learned one thing, people are people. They're different colors and they eat different food, and some of them talk kind of funny compared to what we're used to. But you know what, at the end of the day, they all want the same bloody thing. They want the government to pretty much work with them, not against them. They want to be left alone, and they want to be able to experience their basic human rights. And it's important to be able to work and have a house to live in and to get medical care. So I would not advocate discriminating against anybody on any of those things, because those are basic things that every human being needs. And what good does discrimination do? What does it satisfy? What goal does it accomplish? Nothing. And it does feel good to be in agreement. We ought to do this more often.
Thank you, Senators, for follow-up. Thank you, Madam Chair and Senator Foreman. So appreciate that. My question is this. It says up here at the top, the state, the political subdivision of the state or public health district cannot And we already talked about subsection 4, which I love. But it says cannot order different things, whether it's to stay in homes or close business, social distance, and wear masks or other facial coverings because of an emergency or extreme emergency, etc. Is a hospital a political subdivision, and would this potentially prohibit them from wearing masks?
Senator Foreman.
Madam Chair, Senator Wintrow, I guess it would depend on the funding of the hospital, how it was structured, organized, and financed. So it could be that, and I think the operative word there is, or two words are in general. I'm not opposed to masks or quarantining. Those are necessary tools, but in my research of existing Idaho code, those codes call for more specificity. In other words, quarantine if there's reason to believe a person is contagious and for the good of society and the person, they need to be quarantined. I would apply that same rationale, and I have in this bill here, to masks and social distancing and the whole 9 yards of that scenario. I'm not opposed to any of those techniques. They're valuable tools and they need to be used at times. But when you say in general, as in the whole state of Idaho or everybody in a town, with no specificity or no indication as to who may be sick or not, then I think it kind of starts to intrude. I think it's just overreach, A for effort, but just a little bit of overreach there.
Question, Senator Taylor.
Thank you. Just one other question that came to mind on this. On that page 1 under 6, where no patient shall be administered any experimental drug, how does that work with Title 39 and the Right to Try Act, where it doesn't say that you need to sign anything, but you have the right to try an experimental drug?
Senator Foreman.
Madam Chair, Senator Taylor, I don't believe I have anything from Title 39 with me, but my bill says with informed written consent. I'm not opposed to anybody under dire circumstances grasping at that last straw. I think that's their moral right, but I think they just need a thorough understanding of the question being posed to them. If I do X, what happens? If I do Y, what might happen? And I know in our military, in the heat of battle, again, not pointing fingers at anybody, drugs were administered to troops without any sort of informed written consent, even though DOD directives called for it. And I understand it was a panic type situation. People were in a rush. They were trying to do the right thing. But in an emergency, and when people get in a rush, that's more than ever the time when we need to stop and follow all the directives for the safety and protection of everybody. So I'm not opposed to people having the right to try. In fact, I'm all for it. If a doctor came to me and said, you've got one chance, my friend, and it's an experimental drug, but you need to read the literature that we'll give you so you make an informed, can give informed consent, I'm all for that. But to try to give somebody an experimental drug without that, I think is a breach of faith between the provider and the patient. So that's where I stand on that.
Questions? I have one. On 14 on visitation by patient's family members or legal guardians shall be allowed unless the patient refuses visitation or visitation is expressly denied by the attending physician for sound medical reasons in the best interest of the patient. So I'm thinking about, my mother is in an assisted living center and there are 14 residents there. Mm-hmm. If a doctor or doctors deem that visitation and says they can't have visitors because of sound medical reasons, say there's, 7 of them out of the 14 that their doctors say that. How do they handle that in a situation like that where they're all in one facility? How would they handle that?
Madam Chair, good question. I hope that the message here in my paragraph 14 in my bill is clear. The doctors reign supreme there in my mind. If the physician in his, her, or their best medical judgment need to restrict visitations, then my bill says, and I would personally say by all means. Now, in a communal type situation like that, given the age of people and how susceptible they are to the spread of disease, the intent of my bill there would be to collectively apply the judgment of the combined group of physicians, and they may have to apply that to everybody, which is in keeping with other Idaho code currently existing that deals with emergency medical situations and applications. So I don't see any conflict there. The intent of my bill is to go with what the physician says. What I wanted to avoid, which unfortunately happened on occasion during COVID, was having administrative people just say en masse, no visitors for any reason. We had people die in our institutions. They weren't able to say goodbye to their loved ones. You know, I'll give the benefit of the doubt to the medical community all day long because I've had really good care. I know a lot of nurses and doctors from my police officer days. They're all great people, and they're healers, they're caregivers. They try to do what's best for people. But sometimes in the heat of battle, trying to do the right thing, we do the wrong thing, and we look back and go, wow, you know, we didn't really need to do that. Maybe some people were hurt, deprived of chance to say goodbye or what have you. So that's why we need to codify what sometimes looks like common sense or basic human rights, but it needs to be codified, hence this bill. But I don't see any conflict between that situation and my bill. I certainly didn't intend for there to be one.
Thank you. So if a doctor's orders, so you're saying doctor's orders should stand?
Yes.
They should be the precedent?
Absolutely.
Thank you. Okay, committee, we have a few people to testify here. First up, we have Kelly Packer. Welcome to the committee.
Thank you, Madam Chair. My name is Kelly Packer. I am the Executive Director of the Association of Idaho Cities. I appreciate the opportunity to stand before you today. I stand in opposition to Senate Bill 1009 because of how broadly it is written. It talks about the state and political subdivisions and public health. Then it talks about medical services, which brings in the hospitals and medical facilities. We talk about what we can and can't do in emergency situations. We talk about advertisements. We talk about health care provisions.
Kelly, can I stop you just for a second?
You bet.
We have a few people and our time is growing late.
Okay.
So I'm going to go ahead and start a timer and we'll give everybody.
No problem. I'm almost done anyway.
We'll give everybody 2 minutes, I believe.
Wonderful. No
Thank
problem.
you.
You bet. And I am almost done. I just think that some of these provisions taken separately would be fine, but putting them all together I think is way too much for all of the people that would be impacted by it and all of the provisions that are being sought to be remedied. So with that, I would ask for you to hold Senate Bill 1009 in committee. Thank you.
Thank you. Any questions? See none. Thank you. Okay, next up, we have virtually Kathleen Bynum from Boise.
Can anybody hear me?
Yes, we can, Kathleen. Please
Oh,
proceed.
thank you so much. My name is Kathleen Bynum, and I'm in Boise, Idaho, Boise. And I just have a brief thing to say. Can you also see me?
No, we can't.
Okay. The only thing I want to say is with the mask mandates and so many mandates, not many people read the back of the face mask box. but I just want to read it. It says, when properly worn, it reduces potential contact by the wearer of blood and bodily fluids, but in caps does not eliminate the risk of contracting any disease or infection. So I've heard many doctors say it's virtually pointless to have the mask. So that's one of the mandates I've had the hardest time with. So that's all I have to say.
Would you stand for questions, please, Ms. Bynum?
Yes, of course.
Okay. Are there questions of the committee? I'm seeing none. Thank you so much for testifying virtually. We appreciate that.
Thank you for the opportunity.
Next, we have Lyle Johnstone. Mr. Johnstone, are you on?
Yes.
Okay, please proceed.
Thank you, Madam Chair, and the Health and Welfare Committee. I recommend a do pass on Senate Bill 1009, 2019, 2021, and 22, even into 23, have continued to violate health standards, vaccine mandates, mask mandates. These are rights that are given to man by God, and they are not to be battled with, regulated, and legislated against by man. Not the legislature, not the Department of Health and Welfare, or even hospitals. A friend of mine, who is a mental health care professional, stated that all of his patients were greatly affected in 4 ways from these mandates during that period of time. And so my recommendation would be, as a do pass, I thank Senator Foreman for writing and bringing this bill. I do have some issues with line 28, but I still don't. Thank you. I stand for.
Thank you, Mr. Johnstone. Are there questions? I see none. Thank you for your testimony. Okay, next we have Tony Lawson in person. Welcome to the committee.
Thank you, Madam Chair, members of the committee. My name is Tony Lawson. I represent the Idaho Hospital Association. We represent every community hospital in the state of Idaho. I'm here today to voice opposition to Senate Bill 1009.
Oh, well, of course you are.
Mr. Johnstone, your time has expired. Okay. Sorry. There you go, Tony. Go ahead.
If I could have my time start over, that'd be great.
I am.
The new section of statute proposed here would apply to state and political subdivisions of the state or public health districts. County and district hospitals are political subdivisions of the state, as are state hospitals. So this would apply to some hospitals, but not other hospitals, but actually most of the things already apply to other hospitals because there are so many parts of this legislation that are duplicative to state and existing state and federal laws. I don't know if I can list them all in 2 minutes. Almost every point has either a state or federal law that already applies to that area, including informed consent, including the right to choose a provider, including, well, actually, right to choose a provider, this would have implications perhaps for our Medicaid program, and possibly if you're looking at Medicaid managed care, patients don't always have a right to choose the provider they want. They have a choice of providers, but that isn't necessarily the provider they choose. So there are questions there. Right to privacy is already covered in HIPAA. We have the area requiring hospitals treat emergency patients. We already have a huge section of federal law, EMTALA, dealing with hospitals, a requirement to deal, and it includes all of the age, sex, religion, race, everything, and also ability to pay, whether or not you have the ability to pay. So that is already in federal statute. The visitation language actually is some of the best language that we've seen so far on this issue, which is the most practical language we've seen around visitation so far. So that is probably the least problematic. I'm not saying it's perfect, but it's least problematic. So I appreciate the senator's efforts here, but without sounding too flip, I think this bill is repetitive and redundant and unnecessary in almost all of the points listed. And with that, I would ask that you hold the bill.
Okay,
Happy to answer questions.
Senator Berkey.
Madam Chair, Ms. Lawson,
Yes.
you mentioned that this is duplicative with federal statute and some state statute. And how many of those federal statutes, let's just say HIPAA, were violated over the 2-year period of COVID? And list any other things that we take for granted that are in statute that we weren't able to be afforded during that period of time. How many things?
Ms. Lawson.
Madam Chair and Senator, I'm not sure that there were any times when HIPAA laws did not apply, even during COVID. I'm not aware of that. Again, it's not an extensive review, and I'm happy to correct myself if I'm not correct. But I don't believe there is any time that HIPAA didn't apply and those protections didn't apply, nor was there any time that EMTALA did not apply to hospitals, nor was there a time when protection of people's human rights and civil rights did not apply as far as treating patients. So I'm not sure if there's a specific area you thought was violated.
Madam Chair.
Follow up.
Ms. Lawson, I know just on personal experience that my rights to keeping my vaccination status, those HIPAA rights were violated. And that's just one person, that's just me. I'm just, we're looking at some language here as we have in a couple other opportunities this session that are the result of not imagined violations of people's personal and civil. I mean, there's numerous rights that people were not afforded. In this type of legislation would not be coming forward had it not been for those issues. I just don't want there to be this sense that this all was generated in a vacuum. There are reasons why the public and the citizens that we represent feel the way they do about these things. We can debate on whether this is the most perfect legislation to address those issues or some of the other issues that have come back and come to the forefront in some of the other legislation I've looked at. But it's not out of this imaginary experience from our citizenry that these things have come to light. And I just want to make that point.
Thank you. Ms. Lawson, I have a question for you. On the number 8, a patient has the right to choose the patient's healthcare providers. A lot of times our insurance has in-network and out-of-network. Would that possibly affect that?
Madam Chair, depending how broadly, and that's one of the challenges of this piece of legislation is the language is so broad. And so I don't know if it would conflict with those areas of your private insurance. You have a right to choose someone out of network. You can pay out of pocket to do that. If you're a Medicaid patient, I don't think you have that ability. You have a choice of providers, but I don't think you can go to another provider and pay out of pocket for that. So it could run afoul there. Well, that's...
You're fine. Thank you. Senator Winthrop.
Thank you, Madam Chair, and thank you, Ms. Lawson, for your testimony. What would be, so it sounds like a lot of things are duplicated. There is some vagueness, you indicated, but what would be the most catastrophic thing that would happen if we were to pass this? Like, are there really awful things that are gonna happen, or tell me about that?
Ms. Lawson.
Madam Chair and Senator Winthrop, I don't know that there are catastrophic things here, but in my almost 20 years of experience in the area of health policy, it's sort of been a general rule that you shouldn't pass legislation that isn't necessary. And the more legislation you pass that is duplicative, the more chances there are for different interpretations of what one section of code means over another section of code, or whether one section trumps another section, or if federal law trumps all of them in that area. So the more unnecessary language that we put in, I think the more problems that we cause. One of the big problems for hospitals here is that they are political subdivisions, and some of these areas, for example, that you can't require a mask in general, I don't know what in general means. In general, hospitals require masks in operating rooms. In general, hospitals require masks in any number of areas. So some of these things are so broadly, well, they're not defined. That's the problem. The statements are so broad and they would apply to specific hospitals. So that, again, adds to the confusion, adds to areas of differences in interpretation. And then because it does include also a section that adds, if I can find it now, I believe there was a section adding private right to action. Now we get into any number of interpretations could mean any number of lawsuits, and we already have a lot of lawsuits in the medical area, and I don't know that adding language that potentially adds to the lawsuits is the best policy at this time.
All right. Thank you. Thank you, Ms. Lawson.
Thank you.
Appreciate it. Okay, next we have a virtual testifier. Nikki Zog. Ms. Zog, are you online? Oh, there you are.
Yes. Hi, Madam Chair.
Hi, could you identify yourself for the committee and then proceed?
Yes, thank you, ma'am. My name is Nikki Zog. I am the director at Southwest District Health located in Caldwell. And the bill as currently written appears it would prohibit public health districts from issuing orders to protect the health of the community. It appears to conflict with existing law outlined in Idaho Code 39414 and 39415. The language in general and also emergency, extreme emergency, or medical emergency are not well defined, and it is unclear if the bill intends to address community-wide orders or individual orders, and what constitutes an emergency, extreme emergency, or medical emergency. Furthermore, prohibiting the public health districts from publicly recommending the use of therapies that are considered experimental or prescribed for off-label use could have a detrimental impact on the health of Idahoans if in the future we were faced with a new disease or a biological weapon or an existing disease that is no longer treatable with traditional therapies. It is also unclear if this bill language would extend over-the-counter medications such as medications, vitamins, or minerals that may be helpful in boosting the immune system and recommended when other preventive or treatment therapies are not available, since they may not be labeled for use to prevent or treat a new or existing disease. Thank you for the opportunity to provide testimony, Madam Chair. I'll stand for any questions.
Questions for Ms. Zog? Senator Seiderfeld has a question for you.
Thank you, Chair. Thank you, Madam Chair and Ms. Zog. You brought up when in the code where it's talking about experimental drug, and you brought up what was the terms that you were using again? Biological warfare, or what was it? Can you?
Ms. Zog.
Sure. Yes. Thank you, Madam Chair. Senator, I used language, so like a new disease, a biological weapon, or an existing disease that's no longer treatable with traditional therapies, such as like a drug-resistant tuberculosis. It's a good example.
Okay, thank you.
Thank you. Other questions? Seeing none, thank you so, oh, wait, to have a question here. Senator Lee.
Thank you, Madam Chair, and thank you, Dr. Zog. My question has to do with, some of the things that we heard during the pandemic was promotion of vitamin D or other therapies. Do you think this bill would have prevented your public health district from making any of those recommendations should you want to?
Ms. Zog.
Madam Chair, Senator Lee, thank you for that question. Yes, in fact, our district did promote on our website alternative therapies and ways to boost a person's immune system, particularly before a vaccine was even available. And my concern about the bill language now is that it's not specific enough to where alternative therapies that a provider could recommend or prescribe may not be allowable because they'd be considered off-label in my understanding of the way the bill is written currently. That could include like zinc and vitamin D, even hydroxychloroquine, back when, before there was a vaccine available. So I think that language just is a little bit vague and would be hard to implement in a way that maybe wouldn't put the public health districts, or at least Southwest District Health, I should say, at risk if we were looking for ways to help our community be healthy and prevent disease and disability from a disease.
Thank you. Other questions? Okay. All right, committee, we have a couple more testifiers here in person. Thank you, Ms. Zog. Thank you for calling in. I appreciate that.
Thank you, Madam Chair.
Okay, next we have Blaine Conzati. Welcome to the committee.
Thank you, Madam Chair. Members of the committee, my name is Blaine Conzati. I serve as president of Idaho Family Policy Center. We stand opposed to Senate Bill 1009 in its current form. And while Idaho Family Policy Center would likely support the general goals of much of this legislation, we want to express our deep concern about subsection 4. And I know that there's been some dialogue already, so I won't reread that subsection. But I will just point out again that among other things, the patient cannot be refused treatment based on sexual orientation or gender identity or any other basis prohibited by federal law. We fear that that provision would eventually be used to cause harm and mischief. Although we certainly would never want any person denied necessary medical care because of discrimination, the federal government and federal courts have interpreted similar prohibitions on sexual orientation and gender identity discrimination in ways that undermine religious freedom while also jeopardizing patient health and well-being. So, for example, the federal government has interpreted one such provision as requiring medical providers to administer and perform sex-change drugs and surgeries, which is obviously something we are working against. As well, or another example rather, subsection 4 could be interpreted as requiring hospitals and doctors to notate the wrong biological sex in a patient's medical file, which obviously would gravely endanger the patient's health, considering the importance of biological sex in diagnosing and treating certain medical conditions. So again, Idaho Family Policy Center certainly supports the intentions behind this legislation. It's just this one provision, subsection 4, that causes us the rub. So I encourage the sponsor of the committee to rework that provision, and I'm happy to stand for any questions you might have.
Any questions? Seeing none, thank you so much.
Thank you.
Okay, next we have Garth Gaylord. Welcome to the committee. Please identify yourself for the record when you're ready.
Garth Gaylord. Well, first, just in signing up to testify here, there's a part that says, are you for or against it? and I'm strongly for part of it and strongly against part of it. So that's the same as with another person. So I encourage the legislature to change that way to sign up for public testimony along with all the other personal information. I don't think that's necessary. And actually, I would more encourage you to stop doing these kind of bills that have 100 issues in them. Like, take one issue at a time. Okay, so I'm strongly against the parts about patient rights, because nobody has a right to health care. You have a right to get health care. The government shouldn't stop you from getting health care, or anybody, if you're for asking for health care, I mean. But the government should not tell anybody, you have to give this person certain health care. I think you should be able to discriminate for anything. That's the right of whoever's offering services. But what I'm strongly for is 1A about mask mandates. Well, I'll specifically talk about mask mandates. And I have a YouTube channel, Garth Gaylord, if you want to see my videos of what's personally happened to me because of these mask mandates. It's to say that I'm a danger to other people, that I'm violating someone's rights by not wearing a piece of cloth over my face or whatever face covering. And someone pointed out the box, like at the courthouse, it says non-medical, made in China. And yet they're mandating it on us as a medical device. They, or facial attire or whatever. It's like, they prevented me from entering the courthouse because my freedom of conscience was violated because for many ways, but one is, since I don't believe the mask is effective in protecting anybody, it goes against honesty. I'm not going to pretend, wear a mask and just pretend along with this game that I think is not only dishonest, but is harmful to people. I think the masks are harmful.
Mr. Gaylord, your time is up, and we thank you for coming.
They tackled me down. They threw me in jail over a mask.
I'm sorry. Thank you. Thank you. Okay, any questions, committee? Okay, thank you. Seeing none, I don't see any other names on here. Does anybody else in the audience would like to testify? Senator Foreman, would you like to close, please?
Thank you, Madam Chair and committee. And thank you to everybody that testified. I really like it when people show some interest in affairs and come out and take their time to comment to us. It helps us make better law. But I heard a lot of talk about how this bill is redundant. It is not redundant in one regard. Show me a comprehensive patient bill of rights listing anywhere. Now, there are some organizations in the medical field that have their own proprietary bill of rights, but nothing is codified all in one. They're scattered throughout a few very generic state laws and a bunch of federal laws. And if the current situation with those laws was acceptable, I have one question. Why didn't it work during COVID? There were abuses that occurred during COVID. Now, again, I'm a supporter of the medical community, but I have really good vision and I have a good memory, and I talk to a lot of people, and people's rights were abused during COVID. Maybe not on purpose. I'll give folks the benefit of the doubt. I like to do that, but still, some people's rights were abused. I talked to people who experienced it, and I saw it in my own family. I think it would be far better and more functional and more useful to have a patient bill of rights here in the state of Idaho, written by and for Idahoans. Easy to read, easy to find, rather than rummaging through dozens of federal laws and a few other state laws. The people of Idaho deserve and need a patient bill of rights because it's only listed, like I said, piecemeal in other places. What organization or group would oppose or would advocate for any type of discrimination against a human being that shows up for health care? I'm not going to buy into any technical explanation that tries to justify that, or any legal explanation, or any scientific explanation. This bill is not scientific, it's not technical, it's human. It says that people are entitled to at least not suffer being turned away because of the color of their skin, their sexual orientation, or any other fabricated reason. To do so is inhuman and wrong. And I heard it stated that this bill is unnecessary. I beg to differ. It's very necessary. The human suffering, confusion, and fear. I can't tell you how many doctors I talked to that said their patients were afraid. In the state of Idaho, United States of America, they were afraid to come to the local hospital and see their doctor. And now we're seeing the uptick in cancers and other horrible diseases because the preventative testing and routine checks that people normally would go for, they didn't go for. Why? Because they were afraid. My friends, the system is not working. This Bill of Rights is absolutely necessary. And again, I'll say it, it's not political. Not political at all. This is a bill in defense of human beings. I think it was also mentioned that emergency and extreme emergency aren't mentioned in Idaho code. Not true. They are defined in Idaho code. In fact, Idaho code says a pandemic is an extreme emergency versus a regular emergency. So I'm sure everybody has the best of intentions. The people that come here are good people. They come here because they believe they have something to say and that we need to hear it. And that's good. That's the way it should be. But folks, we need this. We need this bill. We need a one-stop shop. Is the bill perfect? No, I haven't never seen a perfect bill. But this bill will go light years in protecting the rights, the decent, basic human rights of Idahoans. And that's why we need it. And I think we can reach across the aisle and for once, put that ugly monster politics aside, which is a necessary evil, I get it. But not with this bill. This bill's for the people of Idaho. Thank you.
COVID was politicized by Trump.
Okay, committee. The bill is before the committee at this time.
Madam Chair,
Senator Zeiderfeld.
I'd like to make a motion.
Motion's in order.
I'd like to motion that Senate Bill 1009 go to the floor for debate. With the due pass. Okay. I motion that Senate Bill 1009 go to the floor for debate. With a due pass. I don't. No recommendation. I'll stick with the due pass. I'll stick with the due pass. Okay.
Then move, and then we. It's been moved that Senate Bill 1009 be forwarded to the floor with a due pass. Is there a second?
I guess, Madam Chair, I'm just asking for a point of order or clarification about what is the motion.
The motion is to send Senate Bill 1009 to the floor with a due pass recommendation.
Okay, thank you.
Is there a second to the motion? Been moved by Senator Zeiderfeld, seconded by Senator Bierke, that we send Senate Bill 1009 to the floor with a due pass. Is there a discussion? Senator Lee.
Thank you, Madam Chair. Thank you, Senator Foreman. I absolutely appreciate what the people of Idaho have been through. I heard it for a lot of that time, and I'm really excited about parts of this. The first section, though, I think is conflating two issues. It talks about what political subdivisions can't do, and then we talk about patient rights. And I think that, again, I'm not looking for a perfect bill, but this inserts a lot of complexities without looking at what we did in respect to reining in some of the Department of Health and Welfare's powers, the director. We did assign a lot of the authority back to the locals to make local decisions. And I think this adds some confusion with our other statutes. And so for that reason, I won't be supporting the motion.
Senator Zeiderfeld.
I just want to make some clarifications along with my motion and just give some thoughts. This bill was much needed. We need discussion. And I think one of the things that this bill brings forth is that discussion. I've had many people in my personal life that have been harmed from the lack of not being able to visit loved ones. And I've had people harmed by the masks, and I've had people harmed by just all the different things that was stated here. And I think that as this is not perfect, and then maybe we could add the federal law code in there to be more specific. There's things that we can do there, but I think this is going to open up a discussion on the floor for many things that our people, our constituents are wanting to hear from us. And so I just wanted to make that clear.
Thank you. Senator Taylor.
Thank you, Madam Chair. We heard several times today already that one shoe doesn't fit all feet, basically, right? This one-stop shop doesn't, in my opinion, come close to doing what it should be doing. Not that it doesn't have its merits. I believe it does, and I think with some reworking it could work. But with that, I'll be voting no.
All right. Anyone? Senator Bierke.
Madam Chair, I do appreciate the testimony provided here today. Very thoughtful things said. I have to agree with Senator Zeiderfeld that this is a dialogue that maybe should transcend beyond this small Health and Welfare Committee on the Senate. I think it would be benefited to be included in a bigger dialogue on the floor, and I will be voting for it to go there.
More discussion. Senator Wintrow.
Thank you, Madam Chair. Boy, I feel conflicted. And I just really appreciate some of the comments that were made by the sponsor, and it feels really good to be in alignment with him on that. That no one should be discriminated in their health care based on their sexual orientation or gender identity. That people are human beings and they should deserve the right to the health care they choose. I just really love that. I think there is some redundancy, but that's my question to the person testifying. With that redundancy, would it really be that egregious? There have been a lot of bills being passed, I think, in the body that have been redundant. But I do really want to say to Senator Foreman, I appreciate so much your conversation there, and I would look forward to partnering with you on that in the future. The only thing that I'm I have a question mark about is if there's any prohibitions here in future health emergencies of similar types. which is why I asked the question I did about political subdivisions. And if it would prohibit, like in hospitals that are a part of those. I know there are a lot of private hospitals that don't basically, wouldn't adhere to that, but just wondering if that would cause a kerfuffle for them or if that could be worked out. So I do feel conflicted. I'm not sure exactly how I'm going to vote yet, but I appreciate the conversation and I appreciate the discussion.
Senator Lee.
Madam Chair, just for a final comment, I appreciate the discussion about wanting just to get this to the floor, and I can recognize that. I think as a committee member, I think our committees are uniquely designed to be able to ask questions and to take testimony, which is something that our floor is not designed to do. Doesn't mean we can't pass that, but that's one of the reasons why I think we can get something ready for this session. But this one for me is not ready to go straight to the floor.
Senator Wintrow.
Madam Chair, I would make a substitute motion to send the Senate Bill 1009 to the floor with no recommendation.
It's been moved to send Senate Bill 1009 to the floor with no recommendation. Is there a second?
I have a second.
Senator Zeiderfeld would like just a description of what you just. She's new, remember? She's a new senator. You've got to explain some of this.
Thank you, Madam Chair, and Senator, thank you for the question, but I realize that the point might be moot. I was hearing the discussion that people were a little struggling with sending the bill to the floor with a do pass recommendation, so I was going to make a substitute motion to send it, which I did, to send it to the floor with no recommendation, which you can do. But I think also, since you made the other motion, you cannot second my motion, I think is right.
All right. Substitute motion, there's no second, so it dies without a second. We're back to the main motion at this point. I just want to make a comment. When Senator Foreman brought this to me, I really struggled with this, and he probably thought I was putting him off for a long time, but I was trying to wrap my head around what was in this bill. You know, a lot of the times, a lot of legislation we look at deals with one topic and maybe a couple of topics. As I struggled with this one, I felt like there were a number of topics in this bill, and there were a lot of things, like other people have said in here, that you could support and things that you couldn't support in it. And that's kind of how I've landed on this bill. So I did talk to Senator Foreman about the bill in its current state. I wasn't able to support. So my vote would be a no vote on this. So anyway, I would just like to give that comment. Okay, committee, we have before us a motion to send Senate Bill 1009 to the floor with a do pass. All those in favor, say aye. Aye. Opposed? Okay. I'm in doubt. I would ask for a roll call vote. Senator Lee has asked for a roll call vote. Okay, ready? Senator Bierke. Senator Zeiderfeld. Aye. Senator Lee. No. Senator Wintrow. Aye. Down on the end. Senator Taylor. And the chair votes no. The motion has died at a tie in the committee. Thank you, Senator Foreman. Okay, committee, we have no other things on the agenda. We will have a meeting tomorrow.
Good.
At 3.